Hey everyone, Jeff from Lewis Physical Therapy and Sports Rehab here. I want to talk today how I go about treating the unstable throwing shoulder. Now, what I mean unstable, it could mean either a actual instability due to an injury, whether it is a labral injury, rotator cuff injury, or just individuals that just have a lot of mobility in their shoulder. So before we even kind of get into a little more specifics, I want to talk about how we go about profiling athletes. Now, there's a certain screening process. We take every picture that comes through our door in terms of shoulder range of motion, shoulder strength via dynamometry, specifically, ER/IR from a rotational strength standpoint. We're looking at their elbow range of motion, forearm strength in different angles, hips, thoracic spine, core, a lot of things that go into that. But in general, how we go about profiling guys in the simplest term of whether is this an individual that is a mobility candidate, are they a motor control candidate, or are they more of a stability strength candidate? So when we look at the unstable shoulder more than anything, there's generally, these are trends that I've just found personally and anecdotally from the athletes I've seen here in the clinic. It is typically your very taller individuals, your taller high school athletes specifically, guys that are just going through a growth spurt and they're growing. They have long arms, which goes back here. Longer arms, which again, we want to think physics, the longer arm, a longer lever, more force is going to be required to control and stabilize those joints from an isolated standpoint. And then if we look at what is their injury history kind of telling us, it's these individuals that they have a history of joints on the shoulder, whether it's like, subacromial impingement, things like that, labral, or passive tissue injury. So again, not only joint, but when we look at passive tissue, is this a guy that has had chronic UCL sprains, chronic labral issues versus more soft tissue, flexor pronator, pure rotator cuff? Again, this is not how it always presents, but these are just things we are thinking of and looking at that as we're starting to see these certain things, they profile a certain way, we're listening to injury history, it's just pointing us in a certain direction. The other side of it here too is these guys have a difficult time recovering. And that can be very multifactorial. There's a lot of things go into that. But generally the guy that's like, hey, I pitch and I'm sore for 2-3 days after that, generally in the shoulder, in the lat, which again just tells me they are not getting great stability from a local standpoint at that shoulder, and the stress is going elsewhere when they're pitching more than anything. We'll come back to this, but this is also the kind of stretching versus loading concept. So if I'm checking a guy's range of motion and they're tight in their lat, they're tight in their lat, going overhead and other movements, not necessarily rotational, and they're like, dude, I stretch my lat every day. Why is it tight, this and that? Well, that kind of makes me think, hey, that stretching like that or that tightness that they're feeling in their lat and whatnot is probably a reflexive protective mechanism to kind of lock that joint down because it needs stability. And the way we kind of use the treatment as a diagnosis, where the lat's a perfect example. There's plenty of guys I take with a very tight lat. Before I do any tissue work, we load the lat isometrically. And sure enough, a lot of times we put them back on the table, we check their range of motion, they get about 5 to 10 more degrees of that shoulder flexion with their scap pin. So again, a lot of this is we are identifying not only from an examination standpoint, but the treatments that we see that they respond well to are also going to be kind of pointing us in that right direction. So when we go over into this kind of phase here of the role of isometrics versus eccentrics, for a lot of these individuals, when I'm starting to see this is how they are profiling, I use a lot of isometrics, even if they are not coming off an injury. So from an injury standpoint, we do a lot of long duration isometrics from a pain control standpoint, pain and soreness control. But I truly think more than anything, where we are getting the ability, going back to this part here, where you give them some load and it actually helps improve their range of motion in a positive way, or it tightens them up in a rotational sense. So again, going back to this actually, loading, the stretching versus loading. With an overhead flexion standpoint like that, I have found when guys are tight in their lat, these individuals will get better lat flexibility from isometrically loading a lat. But when they are tight and limited going into internal rotation, that gird that we talk about where they're limited internal rotation, people think you got to stretch the back of the shoulder, all the posterior capsule work, which is true. But in these cases for these individuals, doing a lot of internal rotation specific isometrics, specifically subscap, to get that glenohumeral joint to get pulled back into the joint, recentered, that gives them more mobility. It gives them more freedom to move in that joint nice and smoothly. So again, going back to this standpoint, that's the motor control component here. And I truthfully think that is where a lot of these individuals, and you have someone that responds well there, and they are getting more range of motion from that standpoint, that's because we are giving more stability to that joint more than anything. It's just teaching them, and the brain is working a little bit more in this case of, hey, this is where we want the shoulder to be sitting. This is how we want to recruit, and so on and so forth. I have just found for these individuals when we go to eccentrics, and what I will say from this standpoint is whenever we're looking at throwers, the common things we got to do a ton of eccentrics, eccentrics, eccentrics. I do eccentrics. I'm not saying not to do them. I have just found in these individuals, these more unstable throwing shoulders, these individuals, you have to be very, very smart with how you dose eccentrics. Some guys can do eccentrics 2 to 3 times a week, and they're fine. But some guys, you do eccentrics even once a week, it is a lot for them. Now, we also have to look from the standpoint of if you can't do eccentrics, that's fine. Throwing is eccentric in nature at certain points of the range of motion, so they are getting that stress. I would rather, especially in these individuals, I have found, we jump to this next thing here, daily loading from an isometric standpoint typically responds better for them instead of doing non-daily, so like every other day loading for higher intensity eccentrics and things like that. And again, I truthfully think the reason being as to why these individuals respond better to daily loading is because they are getting more feedback from a neurological level and a motor control standpoint into that joint to stabilize it more than anything. When you start doing a lot of eccentrics and whatnot, if you don't have that motor control standpoint, that joint's just going to be kind of moving all around. The shoulder's going to be moving all around that joint, and you will put a lot more stress on the muscular structures in the area to control it, which is the goal of eccentrics. But again, to the point where it is probably going to impede their recovery, which will kind of go back up to here. So again, taking this step and going into here now, with these individuals, we kind of look at, okay, what does their prep routine look like? What does their arm care look like? And with these individuals, I might actually do less arm care throughout the week in terms of their post-throw work, and I might load up their prep routine to the point where it looks like they are doing too much in their prep routine. But it is a heavy dose of, or higher frequency, not as much intensity, a higher frequency of isometric work in their prep routine. Because isometrics you are naturally going to be able to recover better from, and you are going to get a much more of a motor control stimulus on a daily basis. So you might say, well, a little bit every day, how's that going to be enough? How's it going to be enough for them? But when we look at it more of a macro level on a weekly, monthly, and even couple month period or a season in general, if you're doing isometrics every day at 30 to 60% intensity, you are going to accumulate a lot of tension. Because at the end of the day, that's all that really matters is you want to get good tension into that tissue, and we let throwing be the main task more than anything. So again, in these individuals, I am more likely going to overload their prep routine with a bit more exercises instead of having them doing a bunch of work post-throw because they still have to lift, they have to throw, they have a lot of other stressors going into play here more than anything. So again, this is just a general overview for some trends that I have seen in working with individuals that have that unstable shoulder or the hypermobile shoulder, whether it is from an injury standpoint or a non-injury standpoint. Guys that are coming back from Tommy John and have this, like this is very important of making sure you are treating the individual in front of you, not just saying everyone has to do eccentrics, everyone has to do med ball, everyone has to do ply ball. That's another thing. I really don't do med ball stuff with these guys, to be honest with you. I don't think they need it. You put a ball in a guy's hand, they're gonna be able to throw it. Most guys have been doing it for a decade or more so at that point. So again, it just comes down to being very strategic with each individual, finding it's not a matter of doing everything, it's finding the couple things that allow them to go and perform at their sport. Because at the end of the day, that is all that matters. It does not matter if you are able to do everything in the gym, you're the strongest in the gym, you still have to train. I'm not saying that you have to train and be smart about that. But if you do all of this, but it is not allowing you to be in a position that you can then go and perform on the field standpoint, then we've lost sight of that more than anything. So again, these are just the general trends I've seen. Good overview if you feel like you kind of fall into this category of why we go about certain ways. And there's a lot of isometrics on my YouTube channel. You can go ahead and look and whatnot. And there's probably some other videos that I've talked about this in there, especially some ones on like kind of tendon rehab. We take some concepts from that. But again, if you have any questions on how it's going to apply to you, leave your questions below in the comment section or subscribe to our channel for more content like this.